Hey everybody, it's Skully. In today's video, I wanted to take the opportunity to talk about premenstrual dysphoric disorder, otherwise known as PMDD. So some of you may have heard of this condition. It's seen in people who are female, or in this case, we're just, assigned female at birth, people with uteruses. It can be a very debilitating disease. If you're unfamiliar with some of the symptoms and what it kind of entails, think of it like PMS. With PMS, it happens right before the start of the menstrual cycle, like your period, and it's affiliated with mood swings, bloating, breast tenderness, kind of some of those uncomfortable symptoms that you get right before your period. So that's basically the premise of what PMDD has, except it's supposed to be a lot more severe. So instead of just mild kind of mood swings, like you maybe get a little weepy here and there, you can be suicidal right before your period. You can get very extreme abdominal pain. You can get breast tenderness that's very uncomfortable. These symptoms can be quite debilitating for some people. So as you can imagine, if they're debilitating, you're going to want to seek treatment for these symptoms. So how exactly is PMDD treated? Well, for a lot of people who are being treated for PMDD, it usually entails things like being on birth control to try to help regulate the hormone levels and dealing with the more severe symptoms. There are some people that have to be on psychiatric medications for the severe symptoms, like if they are chronically experiencing something like depression, to kind of help even it out. And given PMDD's nature, it's not uncommon for it to be misdiagnosed as bipolar disorder or even borderline personality disorder with the mood swings that kind of go with it. It's also not super uncommon for somebody to have bipolar disorder and PMDD, or to even have borderline personality disorder and PMDD. So as you can imagine, if you have comorbid diseases going on with premenstrual dysphoric disorder, you're going to have a lot more mood instability than somebody who doesn't have it, and it's going to be harder to treat. Like, more than likely, if you have PMDD and one of those other disorders, then yes, you would benefit probably from being on something like an antidepressant or a mood stabilizer to help with some of those symptoms. Whereas if you just had PMDD, maybe birth control alone could work. But the thing is, people think you get on birth control for something like that and you're all hunky-dory and your life just kind of goes back to normal. There are some women, some people assigned female at birth, that birth control isn't really a simple solution because birth control has a lot of side effects. Like in my case, I have high blood pressure. I know, at my age, you wouldn't think that I would have to worry about something like that, but I do. Because in my case, it's genetic. So if you have somebody like me who was assigned female at birth and has high blood pressure, you put them on birth control and their blood pressure could spike out of control. And you don't want that. There are also some people who are, very sensitive to birth control. They can have worsening symptoms on birth control. It can cause a lot more fluctuation in hormone levels. I know I've had people in my family that have not responded well to birth control, and they've had to go through so many different ones. They've tried the Nexplanon, they've tried the pill, they've tried the progesterone only birth control. And that one you especially have to be careful with because you have to take it at pretty much the same time every day, and if you miss a dose, then that throws everything off. So there are certain ones where taking your medication at the same time every day is very crucial, because otherwise it'll mess everything up. And especially if you are using birth control to do things like prevent pregnancy, well, you don't want to miss a pill, because then you could end up getting pregnant while on the pill because you missed a pill. Medications only do their job when you take them, so it's very crucial to stay on top of your medications if you're going to take something that's very medication sensitive. Which, if you're good at taking medications, and you don't usually have anything to worry about, but let's face it, some of us aren't very good at that. So there's, other things like the NuvaRing, which also has estrogen. Just about any kind of birth control that has estrogen can raise blood pressure. So that really kind of eliminates a lot of the options if that's one of the things that you have to worry about, like in my case. But of course, blood pressure is kind of a whole other can of worms. I mean, with PMDD is kind of its own thing, so Yeah, it can be very difficult to treat something like PMDD and living with the symptoms. There are some people that don't know what on earth PMDD even is. They just think, oh, PMS, oh, that sucked, but that's nothing. No, PMDD is a lot more severe. When you're having to deal with things like the bloating and the mood swings, breast tenderness, I mean, having a menstrual cycle is already very difficult for some people because there's certain anatomical things that are different from one person to the next, like how much you lose every month, and nobody likes PMS or anything, but then if you have PMDD with it, that just makes you dread your cycle every single month because oh, I could really, be this whole nother person when I'm, PMSing, PMDD, if you know that you're prone to being suicidal right around your period every month, and you're just going to dread it even more, and you really have to have a pretty firm plan as to what you're going to do to try to help regulate this kind of thing. That way you can still live your life and do your job and be around your family and not having to have your whole schedule messed up because of your cycle causing these severe mood swings. So I know talking about things like your menstrual cycle is probably something that a lot of people don't like to talk about, but it's a part of life. It's just like how we all go to the bathroom. Not everybody has periods, I get that, but it's nothing to be ashamed of. Don't be afraid to talk about it. These things, I mean, it's like any part of the body, it needs attention. If there's problems in that department, you have to talk to somebody about it. The problem needs to be addressed. You can't just ignore it. And, you got to keep your brain healthy. You got to keep your body healthy. And sometimes there are certain parts of your body, like having a period, can be synchronized to your mental health more than you think it can be. So if you are noticing some changes in your cycle, you really having tough mood swings, really having a hard time, don't be afraid to talk to your primary care doctor or your OBGYN to see if there's anything that you can do about these. And if you don't have an OBGYN, at least tell your primary care doctor, and hopefully they can get you in with somebody who, I mean, unfortunately, they have different kinds of doctors for different reasons. So more than likely, you would probably have to talk to somebody who's more familiar in that department than your family care doctor is. But more than likely, they'll be on your side and they'll have resources available to help you. So don't be afraid to talk to your doctor about it, even if this stuff is kind of hard to talk about. It's like anything. I want to talk about this stuff on my channel to get people talking about it. I don't want people to dread these kind of conversations. I don't want people to be embarrassed because, oh, I have a period every month. It's okay. You know how much of the world has a period every month? At least half the world. So don't be afraid to talk about it. It's okay. It's a part of life and it's nothing to be ashamed of. I know people say it's gross and everything. There's a lot of parts of the human body that are gross that we still talk about it anyway because we have to. And it's okay. So if you're going through a hard time with this kind of stuff, just know that there are treatment options available and there are professionals that you can reach out to for this kind of thing. But until next time, have a great day, guys.